Here we go, it's the show you've been waiting for.
I know you've been waiting.
Just sit back, you will see, you're gonna want some more. They talk about love, life, fam, fun, all in one. Let's take a ride, it just begun. Come on everybody, you're sure to get your laugh on. It's the Candy and Kev Show.
Well, good morning, everybody. It's a Wellness Wednesday, and I'm just going to go ahead and say it right now. I'm just going to take ownership of it. I'm the reason we started a little late because I didn't have a wellness rest last night. But before we go any further, you know what I ask you to do? Go ahead and hit that share button. All right, guys. All right. So, again, as I always say, I'm not going to ask you to do anything that I myself wouldn't do. So, guess what I'm doing? I'm going to go ahead and hit the share button as well, especially for some of my friends who I know would have a great interest in our topic today. Kevin, before we go any further, how are you feeling today?
I am feeling pretty okay. I'm good.
On this Wellness Wednesday.
This Wellness Wednesday. I got to catch up with my the fellas. I missed a day yesterday with my workout, so got to double up today on some things. But I'm good. Good. My mom will be coming home from the hospital today. I'm excited about that. So thank you for all your prayers and concerns for her. And definitely I'm looking forward to that. That eases some of my tension. When I know she's home, she's doing better, and all that good stuff. If anybody knows or has parents, you know.
Well, everybody has parents. Anyone who has parents that are still with us.
Yeah, exactly. Them being, especially when they get up in age, especially in this time that we're in with hospitals being almost the last place you want to be in this world.
Truth.
You definitely, when they have to go in, it's definitely a scary situation. So I'm excited about that. So I'm good, Candy. I'm excited about today's show. Got 2 Howard alums.
This is an all Howard day.
So HU.
You know.
And neither one of us went to Howard.
No. So right now, all of the my people from LaSalle are like, really? HU? It's not LU? Oh, okay. We'll talk to you after the show. But go ahead. If you are from Howard University, if you are an alumnus of, as they call it, the other HU. No, I'm sorry. They call Hampton the other HU. Yeah. And they call, because I got the whole tutorial on this, Howard is the HU Ivy League. Because, there's Harvard and then there's Howard. I don't know. I
can't keep up with them.
I can't keep up with it. Yeah. That's why I just went on to the school I knew. But, if you know...
Hey, give a should out to your university.
Yes,
you got a great education, Candy.
I did.
On them.
Should
have sent all our kids there.
But let me give a shout out to my university, LaSalle University, because let me tell you one thing. When it comes to the area of public health and psychology, I know for the... and social injustice and all that stuff, sociology... In our tri-state area, they always get our faculty, our alum, and all those, to weigh in the news broadcast.
So one of the shows, and this is just for entertainment purposes, one of the shows that we like to recommend certain things that we might watch. One of the shows that I highly recommend that you watch if you had a chance to watch it last night was the season finale. It's For Life. For Life, I would have to tell you, has been one of my favorite ABC shows since Scandal was on. And the season finale last night was amazing. It literally had my heart, even though I know what the end is, it had my heart racing. So if you get a chance, 50 Cent, you guys did an amazing job on that show. What's his name was on there as well? the actor, Frank. I didn't.
Did
I
you
didn't
see him?
him.
I didn't see him.
But you know what? I didn't look for him until I thought about it now, so I got to go back and look. But yes, definitely check that out.
So if HU is in the house, let me tell you, this is an HU Howard University kind of day. This is Wellness Wednesday here at I was about to say LaSalle. Here at the Candy and Kev show. And although we really like to bring you laughter and joy on your morning commute, or now some people are just commuting from the bedroom to the living room or their home office. But it's so important for us to bring you good information, because sometimes we're the last ones to get the good information.
Can I just make one public service announcement real quick?
Go ahead.
So really quickly, I just want you guys to be informed. The Candy and Kev show, we've been talking about it. You've been hearing us talk about it. We've been signed on the Jam Network TV. That'll be coming to all of your platforms within the next few months. They already are getting some of these particular shows. So you guys, if you chiming in, you'll be on that. But some of these episodes will be on there.
Video demand.
It'll be on video demand. You'll be able to download it on Apple.
Are we allowed to say where?
Yeah, can y'all have a conversation?
Oh, okay. Hey, y'all, we done made, Mama made it.
You'll be able to download Jam TV on Apple TV, Roku, Fire Stick, all of those different platforms. And then you'll be able to go on a video on demand and watch the Candy and Kev show until we get live into the studio. You'll be able to see some, and it'll be some special content on there that you won't necessarily see right here. So make sure you go ahead and keep that in mind. So when those announcements come forward, you can download it.
And one more time, I'm going to ask you all to hit the share button, because we have good news you can use. Oh, I thought he's going to do that graphic again. That's the producer over here. But because if you have senior citizens in your life and they're trying to navigate this quarantine and life after the quarantine, if you know some family members that are on the lower scale of the socioeconomic paradigm, I guess, or that's not the right word. I'm not making LaSalle proud right now. I'm sorry. Scale. You want to tag them, because we went all the way across the country and got one of the premier experts in health and inequality, right? So more recently, they put together a pandemic task force addressing specifically health inequality, and that is none other than the Dr. Consuelo H Wilkins. She is the vice president. Because I want to make sure that I get this correct. She is the Vice President for Health Equity and Professor of Medicine at Vanderbilt University Medical Center. So we want to make sure that you all tune in and get this good information. So I'm getting all these things, making sure I have everything tuned up. So Dr. Consuelo H, I'm sorry, I said D. Dr. Consuelo H Wilkins is one of part of the staff leading the Health Inequities and Vulnerable Populations track in the new pandemic medicine track for medical students. Her resume is very, very impressive. Let me pull that up.
Y'all forgive my baby. She can read. I'm telling y'all, she's college educated. She's
It's just so much information.
So baby, come on now. The people saying Kevin chime in and help out.
It's just a lot of information, guys, and y'all just don't understand all of the cues.
And she's a classmate of none other than Mrs. Naomi Hugh, Dr. Naomi Hugh, who we had on the show, talking about dealing with teenagers and your younger people when it came to the pandemic. So she was referred to us, and we're excited to have her on this particular show. We have 4 questions that we sent her to ask in regards to the equality and the healthcare when it comes to this pandemic, and we're going to get right into those.
Right. So these questions were curated from various conversations that Kevin and I have had with viewers, with family members, with people in tough situations, and just watching the news and seeing what's happening. We curated these 4 questions to send to Dr. Wilkins, and she so graciously, let me tell you, she's very, very busy right now, but she so graciously took out time to respond to these. The first question: with your background in national and global health inequity, what are your thoughts on what are your thoughts on what some may view as the premature reopening of certain states? And how will this impact the already underserved population?
Let's get right into her response to this one.
Thank you so much, Candy and Kev, for inviting me to your show. I'm so excited that you are bringing attention to the coronavirus, and particularly some of the health disparities and health inequities that we're seeing. It's really unfortunate that we're seeing so many individuals from racial and ethnic minority communities being disproportionately impacted by this disease, specifically African Americans, Latinos, people who speak languages other than English are really suffering excess burden of this disease right now, and we really need to pay attention to that. So thanks for sending along the questions ahead of time. I'm going to try and get through all of them. So first one I have is, as it relates to what some might view as premature reopening of our local and state governments and businesses, how will that, or could it disproportionately impact these already underserved communities? So I do think that we have to be cautious as we reopen our communities. Just because we're able to return in some ways to life as it used to be, the virus is not gone. The coronavirus is still here. It's still being transmitted in communities, which means we still have to physically distance. We still have to wash our hands. We still have to make sure that we're paying attention to our bodies and listening to ourselves and seeing if we have these symptoms, and then being tested. This is really incredibly important. I think we could argue about whether or not it's premature or not for some places to reopen now. I think whether we think it is or not is probably less important than the fact that if we don't pay attention to this in our communities, we will continue to be disproportionately impacted. So that means we have to be on message everywhere, where we live, where we work, where we play, where we pray. We cannot let our guards down, because the facts are African Americans, Latinos, Native Americans, people who are socially disadvantaged for any reason, who are predisposed because of long-term psychosocial stress, which impairs our bodies. We can't blame just the underlying conditions on our risk for these conditions, for this infection. We have to recognize that we must protect ourselves. We must get as much information as possible, and we have to make sure we're doing everything we can to prevent the spread of the disease.
So what I really appreciated about what she said was, we don't need to waste time arguing about whether it's premature or not. We just need to all be on message and letting, our loved one know that the virus is here and it's still here, and we need to do what we can do to protect ourselves.
I think that was so important, and it was definitely an eye-opener, because a lot of times you see everybody over social media arguing over whether it's time or not yet, and all that good stuff. So again, this is a professional that's telling you, listen, let's not be deterred by those distracted. Let's focus on what we can do. So definitely. So what was the next question?
So before we get into that, and when she was talking about how, actually that goes into the next question. Let me go to the next question. It was something that they talked about on the news today. The question is, many feel the various businesses that were told to reopen in the past few weeks, such as hair salons, nail salons, barbershops, bars, just to name a few, are businesses most frequented by the minority population. What are your thoughts on this?
Let's take a look, listen to her response.
So it's a really important question as whether or not some of the businesses that were set to reopen early in some states, like barbershops, hair salons, beauty parlors, nail salons, bars, whether or not these are places that minorities are more likely to frequent. And could this be purposeful or intentional to predispose some communities to the coronavirus? I think it's important to first remember that minorities are already working. So when we say reopen, the fact is that minorities are more likely to be working in these essential jobs at grocery stores, doing deliveries, packing, working in meat plants. These are places that were never closed in many states. So minorities are already working in these places and really at increased risk of being exposed to the coronavirus. So whether or not now opening up these service industries that might be more likely to be frequented by minorities is increasing our risk. I think it's a catch-22 in many instances. The barbershops and the beauty salons are owned by minorities. So we're serving each other and we are the ones who are out of work. So I think it is something that we have to do cautiously. I think here in Nashville, just this past weekend, seeing in some of the communities, beauty shops, barbershops opening to all different kinds of people, they are frequenting these establishments. So I'm not sure that it's unique or specific to minorities. I think that we might, especially at my salon, probably spend more time there than perhaps the general population might spend with their stylists. So that could be a longer time of exposure, more people. So we do have to be careful in these settings and make sure that we're practicing the physical distancing and that we're really conscious about how much time we're there and how much space is between us and the other clients. So those, I think, are really important things to think about. But again, the truth is, if we really waited a longer time, I'm not sure that we'd know still exactly when the perfect time would be to reopen.
Wow. So it sounds like, our friends who are in those service type of industries, you're going to have to really rethink how you repurpose your space for social distancing and even your PPEs, your personal protective equipment, for not only for yourself, but your patrons as well.
Let me say this. When my barber when this first happened and things began to shut down, when the last haircut that I had, which was a while ago, as soon as I came in, he said, "Kev, no offense," he said, "can y'all go wash your hands and everything?" And, he was and I said, "No problem, man." So he took special caution, but I understand. Right now, my hair is not the most important thing. It's the overall health. And I understand from the barbers and the salon standpoint, they're like, we're not getting any income because a lot of times they can't apply for unemployment because they're business owners, or, certain things like that. So it's one of those things like you feel for them, but at the same time, it's like, what do you do?
And, she brought up a very, important, it was an aha moment for me because I really didn't think about this when I was writing the question. She said, the minority population, those of lower socioeconomic standing, they're already working because they're the ones that are working in a lot of these warehouses, the food industry, and all of it. So, unfortunately, it is the underserved population or the minority population that's actually still working through this pandemic.
You know what I think I'm going to do just to help them along? My barber is good to me. I think that I will go every 2 weeks. I think I'm going to still pay him every 2 weeks. And then when I go back, my haircut's already paid for. That way he can survive. So, Steve, if you're looking at...
You heard what he said, right?
I'm going to pay you every 2 weeks like I'm coming to the barbershop. So when I do go back, my haircut's already paid for. And that'll help them survive. Not everybody will do that for them. So that'll help them survive even now. So
you having credits stored up. Huh?
Exactly. So what was the fourth one?
But that was such... Did you even think about that? I didn't even think about that. Like, she says when they reopen, they're already working now. So, see, this is why I love Dr. Wilkins. The final question.
No, third question.
I'm sorry, the third question. In this time of global crises, how can someone who is a part of the underserved population advocate for him or herself and for their families? This was a very important question. It hit home for Kevin and I because last week Kevin his mother had to be rushed to the hospital, and unfortunately, last year, whenever she had to be taken to the hospital, she had a team of us. It was no fewer than 4 of us with her because she's in her 80s. But Kevin and his sister literally had to drop her at the front door. There was hospital personnel that came out to get her from the car, and that was it. So she doesn't have that person in the room advocating for her. Now, although Kevin and his siblings are calling, this is a very important question for many around the country. How can someone advocate for himself or herself and their family in this time of global crises?
So how can someone from an underserved community better advocate for him or herself and their families? I think it's important, again, to think about really the 3 different sort of levels of how we can experience these disparities. So one is we're at increased risk of transmitting the disease or the virus. So that means we are, in some ways, due to long-term structural inequalities in housing and access and jobs, our ability to have paid leave, to work from home, to live in communities where there's more food security. These are long-term, long-standing issues that really require some policy change if we're going to impact them, which is such an important space for advocacy. This is where we have to make sure that we are not working alone, that we're working in communities together to really try and push for a change in policy that will allow us to be less at risk from the beginning. From the next level is our risk for actually having a worse outcome if we get the virus. And a lot of that is due to perhaps chronic diseases like high blood pressure and diabetes. We have to make sure that we are taking care of ourselves from that standpoint. And I do want to make sure this doesn't sound like we're blaming ourselves for being at risk, because certainly those things I just mentioned with these structural inequalities predispose us to actually having these chronic conditions. So I don't want you to walk away with that standpoint, but we have to make sure that we have access to care, that we're taking care of ourselves long term, that we're getting tested, that we're making sure that there are testing sites that are close enough to our neighborhoods, that they are open at hours that we can get to them, that if we don't have transportation is available for us, and all of those things. And then at the third level is how we're treated once we get the condition. So making sure that we have access to quality treatment. The coronavirus is, COVID-19 is a disease that currently there's no proven effective treatment. Now, Lots of studies are happening. That's changing. We're expecting a vaccine. But guess what? If we're not participating in any of the clinical trials, how will we actually know that these treatments and vaccines work for us? Which requires that we change our mindset about, whether or not we want to participate, how we do that, advocating for transparency and inclusivity in these trials so that when we do have treatments and vaccines, that they'll actually work for us.
And so these are the different layers of advocacy, policy. And I know that last one, because I know my viewers, that last one was like participating in trials. Well, wait, what about the Tuskegee Trials and all of, you go back to thinking about that. Because I know like right now there are, they're making a call for people who were infected with COVID-19 and they now have the antibodies. They're making a call for people to come and to be a part of some testing that they're doing with the antibodies. And you don't see many people of color willing to step up right now. So I never really thought about it that way.
Yeah, we've been bamboozled so many times we don't trust the system. As a friend of mine, shout out to they have a show at night called the Soapbox Live, and a good friend of ours, Aaron Robinson, he said he went to be tested just to see how it was, so he can and he said it was, they stick the Q-tip up, and he said he was kind of nervous afterward because he was like, what if they're actually infecting me? Like, and because we have first of all, you have a lot of different things. You have conspiracy theories that scare you to death. And then you have just how we've been treated over the last hundreds
of years.
So what's the next question? Well, the last
but
question.
I will say about this is, so for those of you who may not know, I had to get tested for COVID way back in the beginning of March. And it was a scary process. But, I trusted my doctor. I trusted, the team working with me. But then again, I had to understand that not everyone has access to the healthcare that I'm blessed to have access to. So there is that measure of not trusting and wondering if they're injecting. So that's why it's important to have, your health team in place if you can before something like this happens. Because when my doctor said, he used my government name, I ain't gonna say it on the screen. He said, I need you to go and get tested. I trusted him without batting an eye. When he said that my mother-in-law needed to go to the hospital, we trusted him without batting an eye. But also, as she spoke about having that team of that community, we created a small community within the hospital so that my husband and his siblings, can check in on his mother even with them not being there. The last question, do you foresee a viable plan for caring for the underserved population as we learn more about this virus? Will this finally be the thing that brings focus into addressing health disparities, bringing this to the forefront in both health and social injustice arenas?
Let's take a look.
I really appreciate the question about whether or not all the attention we're seeing right now related to these disparities, will that be the thing that actually pushes society, pushes the country, pushes us to focus more on disparities and try and address them more broadly? I can tell you, I hope so, but I'm very much worried that after we get over our concerns about COVID-19, then it'll go back to business as usual. And so I think this is such an important time for us to really make sure that we are highlighting these really unjust disparities we're seeing related to COVID-19. We cannot accept going back to before. So what we had before was not great. We have plenty of disparities in health outcomes, and we need to make sure that all the outrage that we're seeing, some from communities and people who've never really thought about this before, that we capitalize on their interests and make sure that we hold them accountable for their outrage. You don't get to be outraged just now and then once we are past COVID-19, go back to business as usual. I think this is an important place and time for us to actually hold people accountable for these disparities, and bring attention to that this is not just something that is due to certain populations having more hypertension and diabetes. This is because of long-standing injustices and disinvestments in our communities, marginalization. All of these things are actually contributing to what we see right now with COVID-19. And this is a time for us to come together, policymakers, folks in academia, general communities, the celebrities who've been bringing attention to this need to make sure that they continue to be outraged and connected, so that we can actually come up with some long-term solutions, which will require policy changes. And we're really going to have to dig deep in order to do that. So again, I thank you for the opportunity to join you.
So we keep hearing that word or that phrase, the need for policy changes. I love the fact that she said, we can't just be outraged now while this pandemic is going on, and then when we're sitting on the beach or wherever after this is all over, forgetting about it. And I love the fact that she talked about the celebrities bringing their star power behind it, because we have seen how with the voting process, when the celebrities bring their star power, some people don't like it, but it's a truism. When the celebrities bring their star power to a cause, it raises awareness in certain populations. And one of the doctors, there's a doctor that's been commenting on the stream. She was a previous guest on our show, Dr. Naomi. This is actually one of her very close friends and fellow former classmates from the Howard University School of Medicine, or medical school. And this is how we met this brilliant woman, Dr. Consuelo Wilkins. So we thank you, Dr. Naomi. But one of the things Dr. Naomi is saying is that we, as a population, as a segment of the population, the Black and brown, non-English speaking people, we need to be a part of the process and how does she say it, in the vaccination development, because a couple of months ago they were saying, little children aren't really affected, and then they're finding out, oh wait, they are affected, but it's showing up in a different form. It's looking like Kawasaki disease. And so what we're finding out is that the doctors are learning more and more about this disease as we go on. They don't know A through Z right now. So if you think about that, then what Dr. Naomi is saying is so true. We also need to be a part of the vaccination development, because we need to know how, the vaccinations will work with different populations.
So this is definitely, it was a great conversation. We would like to thank Dr. Wilkins for consenting to come on and just share some of her knowledge with our audience. We appreciate you. We love you here at the Candy and Kev Show. You can follow Dr. Wilkins right here. You'll see it on the bottom of the screen. You can follow her on Twitter at Dr. CH Wilkins. You can follow her. You can tweet her, tell her you enjoyed her on today's episode with Candy and Kev, and just tell her the information was definitely needed for you guys. And I think we might have to have her back another time to, as this pandemic and stuff begins to evolve and life as we know it begins to change, and we'll need experts like her to give us information, to give us insight for our community.
Right, because they were saying just on the news this morning that the doctors are saying that they need to look into how this disease plays out in the water, like in pools, on beaches and things like that, because they're realizing that they don't know as much as they thought. So they need to begin to research, as the beaches open up, how this is going to play out, like in the water. So we talked about barbershops and salons and places like that reconfiguring their places of business for social distancing. So now the experts are saying, they were just talking about this morning, that they need to see how this virus plays out in water surfaces and things of that nature. So it's going to be a new normal, guys. And guess what? I know that normally you're used to laughing the whole time while you're watching the Candy and Kev show, but it's very important. And I think that for us to be responsible with our platform, now, of course, we don't have the big platforms like all those mega stars, but with our platform, we choose to be responsible. Yes, we're going to make you laugh. We're going to sometimes make you cry, but we're going to awake
we want to be informative and make sure that you have correct information.
Right. We don't just get the person down the street.
Yeah, responsible information, because we want you guys to be well informed, just like we want to be well informed. But we are excited to have our last guest, our musical guest. This young lady, I heard her and was blown away by her talent. And fortunately enough, it was a friend of my son. So I'm going to have him introduce this particular artist, and then we'll see you guys tomorrow. Thank you for joining us. Don't forget, like, share, get this out to the public, tag friends that might be able to benefit from this information, and I'm sure they'll be thankful that they were able to get this information as well.
If you have any questions, keep the conversation going on the comment thread after the show ends. We have some doctors and some medical professionals that I know that are on the thread, that maybe they'll be able to help and answer and give some insight, or at least point you to resources. This has been a Wellness Wednesday here on Car Conversations with Candy and Kev. Up next is this awesome, amazing artist after she's introduced by our son. But listen, we love you and ain't a thing you can do about it, boo.
What's going on, everybody? I am here to introduce to you this next artist, who is a phenomenal young lady, one of the baddest bison that you're ever going to come across, and definitely an artist to keep your eyes on. This is my friend, Halo Wheeler. Make sure you check out her new single, La La La, which you can find on all streaming platforms, and make sure you support. I hope you enjoy.
Baby, you don't pay me no mind. You act like you don't love me no more. Maybe you need space or some time. Your attitude is unpredictable. I don't wanna make you unhappy. If you're not happy, then you're free to go. Oh, I don't want you staying around. If I make you sound miserable, you don't want me, then don't talk to me. Want me, then don't talk to me. Oh, go ahead and free yourself. Oh, don't want me, then don't talk to me. No. Want me, then don't talk to me. Go ahead to someone else. Now won't you be a man if it's over, and just admit that? No. Instead of making me think it's so good between us, which one's to blame? I took too much to handle until I can't take this game. No. This love thing is full of scandals. So you're welcome to walk. You don't want me, then don't talk to me. Go ahead, yourself.